introducing myself as Dr. Johan Anton van Rooyen. A little subject so easy to discuss in an informal manner, affecting all of us in our drought-stricken province, and of course the country is also affected in certain areas. It is my personal view that you're listening to, aspects of what we are now seeing as a pretty nasty crisis in as far as our health being affected by the water shortage. Of course, it's universal that we have a climatic change. Also, there are aspects to what we know are now becoming a little more critical as far as the waterborne diseases affecting the population, and the aspects of the poor not really having good information or fair information as we would normally expect via media or other information services. As it is, this particular rainfall shortage, storage dams, springs, home tanks, boreholes, well points, commercial bottled waters now being available, everything is suspect. And it's become a little question about whether our contamination of these supplies are going to lead to further problems. We all know about the common diseases we pick up with waterborne diseases, the diarrhea, the fevers, the aches, the pains, the dehydration. And of course we also realize that amongst the poorest of the poor, communities that aren't able to actually identify these diseases through lack of information or having some technical assistance or medical services nearby, make it difficult for the population to understand the seriousness of the illness. As it is, we have now reached the stage of water restrictions, and it means everything we use is going to have to be taken as being a supply via either our huge dam system or irrigation systems that are being devised, desalination systems. Everything we are taking in by a water means, whether it comes via any form of bottled water sold commercially, must be inspected carefully by even the most sophisticated people in society. And of course the boiling of the water, allowing it to cool down, will break down bacteria. The common bacteria we know about are the E. coli. It's a whole huge group of infections that are carried by water, and also animals that contaminate our water supply. And not to mention the fact that some animals are in our immediate environment, including the birds, the dog in the house, the rats, the cats, and the lice, and not to mention ticks. So everything comes to us because we share the environment. Water shortage means every animal and human is going to seek a supply. Unfortunately, with this crisis comes a little problem, which means we have the need to avoid animal fluids. Fluids being taken as a contact, whether it's just the lick of the dog, or even the possibility of mosquito bite or tick bite, or even the thought of your food being contaminated that's standing on your table via fly. All these factors, they become pertinent to the disease that you will pick up when you ingest what you prepared for as a human to consume, either the water or the food. It is unfortunately at this very particular time that we've presented several kinds of effects coming from this drought water restriction period. One we all common know is cholera, and others typhoid fever that's come across various parts of Africa. Various vectors transmit these diseases, but the one in the Cape and the northern parts of our country and the eastern parts is particularly worrying. It's called listeriosis, Listerosis. It's a notifiable disease now. A little bug, it's an organism, Listeria monocytogenes, is what we call a gram-positive organism. There are about 34 mammals that carry and have this in their life cycle and have it as part of their shall we say, contamination. And that includes man. There are 17 kinds of birds out there that have this particular gram-positive bacteria, bacilli, living or residing in their fluids. And then, of course, there are the ticks, and the crustaceans that we know of, the sea shellfish. They also have secretions, which we also ingest via the food we prepare. So everything that has become part of a history, man, food, cycle of animals entering our lives, sharing of ourselves between people, has resulted in transmission so quickly from man to man. The most vulnerable, unfortunately, are those who have predisposing illnesses. People with cancer, TB, heart disease, diabetes, people who are physically invalided, incapable of moving, living in unhygienic conditions. Of course, there's also the problem that if you should be in contact with any particular animal or particular bird or food substance supply, we become a sort of a carrier for a very short period of time. Our biggest concern, of course, is the pregnant woman. Just prior to prenatal period, sometimes the mother-to-be will not complain too much. She may complain of a backache, unknown fever, or perhaps not even have a fever, afebrile. But a week or two before her birth of the newborn, she may feel a little more upset about her tummy being upset. And it's during that period that the transmission to the placenta and then to the neonate, the newborn, is taking place of this particular listeriosis, listeria bacilli. If it happens, the child normally presents with first few hours being lethargy, and it affects the central nervous system of the children. They get what they call a type of encephalitis. Humans, adults older than 40, 50, can also present with encephalitis. Children younger than 6 years old will also present with a fever, a febrile fever, diarrhea, dehydration, and of course these headaches, which can be part of what becomes encephalitis, all of which are pretty unhappy diseases to have and presentations of symptoms that need urgent treatment. As we're sitting here now in this present time, the effect on us as humans, the animal kingdom in itself, it has a limitation. There is a chance that the pregnant woman with the disease, having lost her infant, can very healthily have another child with no problems. The disease has a limiting process. It self-limits itself. Once the abortion or the child has died or placenta's been removed or exposed from the womb, then it means that the division between child and mother is over. Mother can reconceive or conceive again and end up quite happily having another child without problems. Of course, our water, how to prevent wasting it is going to be important. How to keep our hygiene in contact, especially the washing of utensils, our hands, our bodies, using wipes. Be careful of brushing your teeth even with the tap waters. Boil the water, cool it down, use that to brush your teeth. Even ice that you put into your social drinks. The ice is going to be taken from the tap water and frozen. That has a contaminant part of it. Even if it isn't just listeriosis, it is many other bacilli, E. coli. There are many other diseases carried in water that can affect the human as well. So we commonly would like to know that at least try and play the prevention rather than waiting for the cure. The treatment is not too difficult. As long as there's somebody available within a few hours, 48 hours is where you really wish to have rehydration. Antibiotics work. And then, of course, it's the obvious choice of the patient and the parent, or the parents themselves who are ill, or the young children, to make sure their doctors are informed and told about their illness, and the doctor must inform the community that this disease is prevalent in their area. Of course, the dangers here are it's the debilitation that follows, and whether your recovery is going to be adequate enough to cope with, especially in young neonates. Death, unfortunately, is quite a high percentage of those neonates. It's circumstantially, it's not preventable if once the child has a neonatal infection. If you intervene early in the first 24 hours and act quite quickly, you can save the neonate. So there are various, shall we say, diseases that go with this water crisis that can be managed. Personally, my view has been we have not been the cause of the calamity. The calamity is also not for nature to correct. We are humans and we have a consumerist attitude, and consumerism is the evil of society. So we've got to take care of how we waste precious water. Our new processes that are in place at the moment, which are used worldwide, desalination, taking the salt seawater and curing it and preparing it for human consumption. It's an old age science. Even taking our simple spring waters, borehole water, well point water, and treating it appropriately can be managed for human consumption. Of course, at this stage, bottled water is being sold as spring water from natural springs. Those two are not pure, uncontaminated waters, but at least the bacteria count there is acceptable to the normal human digestive tract. If you are going to suffer from any symptoms, I think it's best that with any thought to getting better, try and see your doctor urgently or as soon as you can. Even the nurses in your clinics will have an awareness program with this crisis that's happening. They will definitely take note of your stools. If there's a culture needed, your blood cultures will be done. They will check at your blood count. They'll examine you. Some persons may present with a large liver, a large spleen. They may even present with a form of lung discomfort, as if they're not able to breathe so freely. Heart patients suffer worse. The patients often come and present with little papules on their skin, and that's usually in the lower part of the body, from the hips down. So all these little noticeable signs will tell you you're close to the identity of what we call listeriosis, and if it's the meninges of the brain affected, then we call it leptomeningitis. So it is recognizable, and information is critical. It's probably the way we're going to notify more people and be aware in the poorest of the poor communities, even the most wealthy communities who are ignorant of certain information and just carry on as if tomorrow is no need to be concerned. Their tap waters are also affected. Everybody should just be on their guard. And as I said, use hand disposable cleaners. You can use any clothing, washing equipment that you normally would use for dishwashing. Do it, it would be fine. Just dispose of the water rather than you reuse it for any purpose of human consumption. Otherwise, we will be over the crisis once the actual epidemic is over. And it does have a short period to sort itself out. If you are in any way allergic to anything, you must inform the medical officers or medical examiners or general practitioners or nurses. Some of the drugs they use, some people are allergic to them. The biggest choice at this moment is a certain group, and that group of drugs have been around for centuries. Well, not centuries, but a few, 50 years. The sulfonamides, the tetracyclines, the amoxicillins, the penicillins, they still work and they're still available. It's interesting to note that in 1893, Henley was the man who first actually described the pathology of this listeriosis. So having covered that subject as far as our water contamination goes, there are so many other lectures or talks or interaction you can have with the people to ask, what else are you suffering? It doesn't necessarily have to be listeriosis. As I mentioned, there are some parts of the country, typhoids, cholera, good old E. coli, viral gastro from other bugs that affect your stomach, all of which are treatable if caught in time. So awareness, prevention is probably the most key and important features of being available to seek help as soon as you don't feel too well in this particular water crisis we're having at the moment.